Hi, you guys. Today we're going to be discussing schizophrenia. Schizophrenia is a mental illness that challenges how an individual perceives the world, manages their emotions, and how they think. Some of the risk factors for schizophrenia are genetics, pregnancy complications, biochemical imbalance, and substance abuse. Schizophrenia in children is very rare. Normal children generally learn about the world through observations and experiences. However, children with schizophrenia are unable to properly integrate new information. We commonly see learning delays in children with schizophrenia. Some of the signs and symptoms in children are the inability to process visual information, difficulty regulating attention, and lack of contact with reality, and difficulties with communication. Schizophrenia in adolescents are typically diagnosed in late teens to early 20s. Some of the signs and symptoms in adolescents are poor hygiene, mood swings, bizarre behaviors, hoarding food, social withdrawal, and self destructive behaviors. Schizophrenia in adults can be a challenging situation, especially for the supportive family members that are trying to support their loved one. We have seen in the past couple of years a rise in homelessness in this community, and it is very heartbreaking. There's a lot of taboo surrounding schizophrenia, and some of the family members that are trying to support their loved ones tend to deal with a lot of stress and anxiety. Some of the positive signs and symptoms of schizophrenia are delusions, hallucinations, disorganized speech, and agitation. Some of the negative signs of schizophrenia are andorrhea, which is a lack of energy, anhedonia, which is the inability to feel happiness or pleasure, apathy, which causes them not to care much about things, flat effect, where they show no emotion, passive behaviors, and poor report, which means a lack of trust. Some of the treatment that is used to help with schizophrenia are inpatient assessment, pharmaceutical therapy, where they administer antipsychotic medications, cognitive behavior therapy. Some of the nursing interventions for schizophrenia are to first establish trust with the patient, provide a stable and predictable environment, decrease sensory input and reassure the patient, promote medication compliance, and family and patient education, promote good hygiene, and to never argue with the patient. Schizophrenia is manageable with practice and patience, with a loving support team, with taking medications as complied by the physician, attending therapy, and having coping mechanisms. Schizophrenia can be managed. Thank you for watching.